Muy buenos días, bienvenidos. No sé dónde estamos, pero aquí vamos a empezar en español. Nah, I'm just kidding. Anybody that knows me knows that there's two things that I like to do. One is speak Spanish, and the other is to draw. I actually provide scholarships to a handful of kids in the state of Iowa that show artistic abilities. So I'm going to see if any of you are up to mustard first. Fine people here, provided everybody with a piece of paper and a pen. If you take your paper, draw a line halfway through it so you have a top section and a bottom section. And by the way, it was great spending dinner with you last night at the park and breakfast here this morning.
Exactly.
So now, I want you to just pick a person to your right, okay? And in the top section, I'm going to give you guys 60 seconds to do your best portrait, all right? Get your trusty dusty stopwatch out. Like I said, 60 seconds, you know, we can figure out who's good at drawing in the first 60 seconds by how they start. So that's the calculator, not the stopwatch. All right, everybody got their person to the right? All right, 60 seconds, go. Or yeah, if you're alone here, do the best you can with the neighbor. Don't stop me. All right, your time is about half up.
I don't need any more. It's not going to get any better.
Everybody's feeling good?
Yeah, I'm not
All right. 5, 4, 3, 2, 1. All right, how ready to do? Let's see. I mean, we got some. All right. All right. Now, this is kind of a two-part thing, right? Because that gives me a good idea of your fundamentals of drawing. Okay. So now we're going to talk about spatial awareness. In that empty square, you're going to draw the same person. However, this time, I want you to guys first put your pen on your paper, get a starting point. Now you're going to close your eyes, and you're going to draw the same person. So please don't cheat. You can lift your pen off the paper if you'd like, but just do your best to draw. And give another 60 seconds. Go. This is the best part. Give up already.
Well, I didn't need any more parts.
Yeah, I hear you.
Oh, I didn't do that.
Cheater.
No, I didn't. Which is better. Wow. You before you.
Yes.
Oh, I'm impressed with myself.
Yeah.
I made the vision better.
All right, you guys got 10 seconds.
No, I didn't.
5, 4, 3, 2, 1. All right, was that fun?
I was.
Kind of cool, right? It's hard trying to draw somebody by memory and losing where you're at. Unfortunately, like I said, I give scholarships to kids. You guys are all over the age limit. I'm sorry. It's fun watching you draw. And is everybody here pretty familiar with Medicaid? I'm assuming by the group we all work with Medicaid on a little level. Okay. That'll kind of help us keep it short, since I won't spend too much time on the Medicaid part and really talk about Molina. And actually, I'd like to ask my coworker Adrian to come up here and join us. Well, we're going to kind of do this together here. Like I said, my name's Casey. I'm a senior community outreach specialist. So what I spend my time doing is going to a lot of events kind of like this. The crime-free socials I was at last night. There's things all over the state of Iowa that we're trying to be a part of. And right now, we are just getting our name out there, really, because we don't go live until July 1st. So once July 1st happens, I'm sure my job will change, completely. But until then, we're just kind of getting the word out there. And I'll let Adrian
All right, so the distinction between Casey and I's role, Casey is out and about in the community, getting the Molina name out there, making sure that members know that we are here, that their managed care organization may change from Iowa Total Care or Amerigroup to Molina. Right now, we're just wrapping up kind of an open choice period where members have the option to either stay with Iowa Total Care or Amerigroup or transition to Molina for their Medicaid coverage. And so lots of activity happening. Medicaid recertifications are happening right now. And so not only are members being transitioned from one MCO to another, but we're also in this redetermination process that had been on hold during COVID. And so lots of activity happening with our Medicaid members. We want to make sure that they're educated, that they're supported, and being able to retain their medical coverage. So Casey's out in the community all week long, engaging with community members across the state. My role is in provider service. So I work directly with the doctors, the hospitals, the private practitioners, and I'm a dedicated representative for providers in Dallas County. So right now we are very heavily engaged in contracting and credentialing providers. We're trying to build out our provider network to ensure that all of our members who transition to Molina still have access to quality care. They have access to a wide variety of services and quality physicians that can meet all of their needs within the Molina network. So Casey's kind of more on the people side, I'm more on the provider side. Of course, there's a lot of overlap that happens as we look to ensure that everyone has what they need in order to be able to receive health care and for providers to be able to provide it and know that they'll be reimbursed. So that's kind of the distinction between our two roles, but they do work in tandem together in the community.
Okay. All right. So kind of as we've said already, we're the new MCO in Iowa. Like I said, you guys have all worked with Medicaid, so you know Amerigroup, Iowa Total Care, those are the other two MCOs out there right now. We're the third. Like I said, going live on July 1st. Yep, got 30 days. So, and again, this is kind of more the Medicaid side. You know, we're pretty much doing the same thing that the other MCOs are as well in terms of, you know, who qualifies, what, you know, you have to be a resident of Iowa, U.S. citizen, usually low-income families, people in need of certain kind of treatments, medications, things like that. Again, we're offering what I think is a better benefit package than the other two MCOs. You know, not to sound biased, but we offer up to $100 in gift cards that are available to be used anywhere. You know, as long as you're taking your children, yourself to your well visit checks, immunizations, obviously for women, you know, breast, cervical cancer screenings, birth control, prenatal care for pregnant women. We also have doula services, which Tamika Fisher is a lady that works out in Waterloo, but I know she works with our doula services as well. So
Let's do this.
it helps with birthing, basically. I don't want to call it a midwife, but I know it's similar. I don't know the exact differences.
Non-medical. And I'm going to stop for 1 second. I
Yeah,
didn't
yeah.
finish with the doula service. That service is offered and it goes beyond the birth, so they're able to stay depending upon, it's during the postpartum period of that birthing time. So if you'd like more information on that, Casey and I both have, and so does Adrian, access to Tamika, and she's willing to come and talk and provide any additional information, as those two have both shared, is that we're all in it and all of our roles cross over each other. So it is a fantastic thing that we are getting ready to offer. Sorry, Casey.
No, that's great. So, as you guys said, you work with Medicaid, kind of the same thing with us, right? If you are in Molina, you are able to pick a doctor. We obviously have a directory on our website, which is great. We have a mobile app that members can use as well. And of course, an 800 number. Flipping through there myself, I've seen that pretty much having worked with the Hispanic community and Medicaid for 20 years, basically, I kind of know the doctors and dentists that accept Medicaid. Pretty much the same list. I don't know that there's really that much difference. So basically, if members going to a clinic, a hospital, a specialist, whatever, and they're receiving services that are covered by Medicaid, if they're going to Molina, they're probably not gonna have any issues. Anything yet?
And just to add on to that, right now, we are working very closely with the other MCOs, with Iowa Total Care and Merit Group, to ensure that there is continuity of care. So if we have a member who switches from, say, Iowa Total Care to Molina, we want to ensure that any prior authorized services are going to automatically be approved, and that there's not going to be any, claims denials and things that will create either a headache for the provider or for the member as we make this transition. Yes, Vivian?
So, you might have said this already, so I'm just wondering, like, if they're getting that, they all get this letter in the mail that says that it's time to change, but because they get 100,000 mails in the order,
Sure.
can they just call your guys' member service, and do they need to call you and contact the Medicaid, like Iowa Total or Merit Group first, or how does that work?
To do what?
To change.
To make their change?
Yeah.
So, right now, the state is really primarily steering which members transition to Molina. Again, while we're in recertification, there is quite a bit of a challenge with knowing who will recertify, but of the 800 plus Medicaid members, or 800,000 plus members of Medicaid members across the state. Right now, the state is looking to try to divide that membership about in thirds. So right now, Molina is looking at transitioning about 250,000 Iowa Medicaid members to Molina, and the state works to try to keep that even across Merit Group and Iowa Total Care as well. So, to your question, Vivian, when they get that letter, the letter will, and typically it's on the back side of the letter. Some people don't flip that page over to see, oh, your new MCO is, or it may remain the same as what it already is. So, if they want to make a change, then they need to contact Medicaid for that. And Medicaid will make that reassignment of the managed care organization that they're assigned to.
Not the Merit Group or the Iowa Total, but the Medicaid.
Yes, they want to contact IME, they want to contact Medicaid. Yeah, so if they don't make any election, then they will automatically be assigned to that new MCO come effective July 1.
One thing I do want to highlight with Adrian there, and I'm sorry I'm over here, but is that we're out here in the community so that the CBOs and the providers and the healthcare system understands who we are, and that we are a face to Molina. You have questions, you can reach out to Casey, you can reach out to Adrian, you can reach out to me. We're making those contacts for these types of questions because we know that you guys are working with those individuals that are going to have these questions. Even as simple as flipping over that piece of paper and it says Molina, well, you know what? If it was me, I'd be like, well, who's Molina? I don't know anything about Molina.
Yeah.
So I would encourage them, the 800 number is on the back so that they can call in and talk to us. See if we're the provider of their choice. So it is really, truly about making that impression on that individual so that they do get that continuity of care and don't feel that they're being left out of somewhere or just being reassigned as the state calls it.
Absolutely, that's such a great point, Melissa. And for all of you who are working with families that are currently covered by Medicaid, please do encourage them, open their mail. There's lots of information coming out. We've got the MCO reassignments as well as redetermination. And so I was just on a member town hall with IHHS last week, and they advised that if a member loses coverage due to not recertifying, and it's within 90 days of their termination date, rather than applying new, like starting a whole new Medicaid application, they can still submit that redetermination form. So if that comes in the mail and they still have it, they can still complete that to have their coverage essentially turned back on or reactivated versus starting a new application process all over. So if you happen to run into folks and you hear that they're saying that they've lost coverage, that would be the more streamlined route, is to do that recertification even if they've received a termination letter.
And those termination letters will continue because it's not, in Iowa, it's not just the cutoff date of here, it's from where they had applied. So just keep your eyes out for those letters coming in.
Yeah, I will definitely agree that in the last, 3 weeks that I've been out and about, I've probably had, maybe 20 people come up to me and ask, oh, so you're Molina? Oh, I saw a paper, I got in the mail, but I threw it away because I didn't know what it was. And we all do this, right? I mean, I've heard the commercials on the radio. I know that Molina is being advertised, but it only caught my ear because, I'm working there, right? If I'm just a Joe Schmo out and about, I hear that on the radio, I'm probably not gonna pay much attention to it. We all throw junk mail away as well, so, but luckily I am out there and my face is out there and people have been able to see that and recognize, like, oh, I didn't get a letter, or I threw that away, and I've been able to talk with them, so it's definitely happening.
I've heard from individuals, and more than one in the last few months that, oh boy, here comes another one. How long are they gonna last? I don't wanna sign up for them, because they'll just pull out like, this other one. I mean, you got a history of that, right?
Sure.
There was 2 other companies that came in, were really great, and they fizzled. And people that were on that plan, and then they had to scramble around to try to get on somebody else,
It's a legitimate concern,
So,
yeah.
there's gonna be pushback from people. I don't wanna get them.
Yeah,
But the state sounds like it's taking forward.
yes. As far as I understand it, and maybe Russ can attest to this, once they sign up, they're basically, the state's just divvying up, here you're going, here you're going, here you're going, here. How they do that, I don't know. And then.
It's random, just
Yeah.
1/3, 1/3, 1/3.
And to your point, man, and it is valid that MCOs kind of come and go, right? We have a contract term with the state with the option of renewal. And of course, some of this is based on performance of the plan. But it's actually really cool to me that the state has made a determination to have payers to compete for serving Medicaid members well. I mean, if we go back to the days of, Medicaid being run by state employees, there was a much lower level of care than what our members are seeing and experiencing by having multiple payers working to serve Medicaid members especially well. And I have to say that was one of the things that attracted me to Molina, was their focus on ensuring that more marginalized populations have access to quality care, that they're receiving quality customer service, that they're getting timely referrals, that they have access to a broad network that is competing to reimburse providers well, because we want our providers also to be motivated to see Medicaid members. And as part of our provider orientation, and I love that I get to be the one to kind of present on this, but we talk about the fact that all of our members have access to the right for timely care, that they shouldn't be waiting in waiting rooms long, that they should not receive any type of discriminatory treatment because of the payer, because this is a government-funded program, because there may be no cost sharing, or a provider may not be able to balance bill a member. But we want to incentivize them to receive good care. Casey knows all about a lot of the perks and rewards that we're offering to members to partner with their providers to ensure that they're getting that quality care. So I think that the competitive nature of it is still a good thing because it's really easy for any organization that's kind of a monopoly to kind of become complacent in how they care for Medicaid members. Vivian.
I think that adjusting to those changes was really, really hard initially, but it does, like, when I noticed that Amerigroup was bringing on new, like, incentives, and then so was Iowa Total. And now you guys are bringing on this where it says that, they get a $100 gift card, the doula assistance, and also the GED, that's even more empowering our
Yes.
clients to actually, you know, that you hear that they have that goal, but this is just another incentive, so that's awesome, thank you.
Yeah,
Yes,
and I think,
thank you.
I think one other concern I've had voiced, by folks is saying, I'm concerned not just that my primary health, clinic is going to accept this new thing, but my child sees a specialist, my daughter's born and my child will be 3 months to the specialist, and it's that specialist gonna take this Molina, because you
Sure.
don't know, I don't want it.
Absolutely, and that's a huge factor to consider.
Just one quick thing to add on to that, that's actually, I don't have in this presentation, I just thought about it. I just want you guys to know too, and especially if you speak a foreign language, just know, I don't know if you guys are aware of this, but that medical facility accepts federal funding, Medicaid. They are legally obligated to provide language services to that person. So if you guys did not know that and need to fight for somebody, that is federal law. So if they accept Medicaid, they have to provide language services, no matter what that language is, whether that's in person or on the phone, that's up to them to decide, but they have to provide that. And I didn't know if you wanted that.
Does IME set your reimbursement rates to providers?
So we have a budget, and we do have some negotiating ability with providers, particularly with our larger health systems. Do we have the ability to negotiate that rate within a margin of what IME's standard pay rates are?
Specifically pharmacies? Does Molina use a PBM?
We do.
Which one?
What's the question?
The PBM,
The PDL?
the
Yeah.
PBM for,
Caremark, Express Scripts, or
Yeah, I'm not
Optum.
sure, but we can get an answer
Yeah,
for you.
I'll get back to you.
I'm just wondering if my reimbursement on prescriptions will be different with Molina than it is with Irish Health.
well, you know, we're really trying to align as closely as possible with the other MCOs. It has primarily been with the larger health payers that we've had to do some negotiating to ensure that we had adequate coverage in certain areas where our network was somewhat inadequate. But I can always connect you with a contracting specialist who can walk through those details with you and talk through exactly what those reimbursement rates would be.
All right, so somebody mentioned the rides just a minute ago, and that is one thing we're definitely providing. Give us 2 days' notice. We can help you out and get you to but now it is non-emergency transportation. It doesn't have to be a scheduled visit. But like I said, it's unlimited round trips or one-way trips are covered, for an entire year, so that's fantastic. We got the number here that you can get to clients if they need that. Like I said, just the 2 days advance notice is really all we need.
Yes,
Contract.
Do you have one or multiples?
Well, we contract with multiple lines of transport systems, so many of the transport systems, I can't think of any of the names right
All
now.
three of us
but
are with
but
Access
they
to
can
Care.
contract.
Access to care?
Yeah, all three of the MCOs are with Access to Care.
I love the fact that you guys are gonna do food pantry rides, that's awesome.
You said you're interested in? Sure. Yeah, I don't know exactly how the contract language we're using, what the criteria is, but so you're interested.
Another great thing that we offer, as some of you are even here, right, you do kind of case management, or even care management. It is what a care manager is, right? Helping somebody guide the system, whether that's they need help reading that letter that we sent to them, whether that's going to the pharmacy and getting their prescription filled, or kind of like you said, maybe even going through their prescriptions, throwing out the ones that they don't need, scheduling your appointments, taking you to appointments, finding some community resources. So I kind of wish we would have had somebody here from our care management team. It'd be great to really talk about that, but I think it's a great service that Yeah, maybe we can come back next time and bring somebody from the care management team, that'd be fantastic.
Got a quick question back here.
So how can we speak with a care manager? If one of my family wants to know about Molina's Health, how can they reach these people?
I think, was my card handed out with the
Yes.
flyer? I think it was.
Yes.
Laura, if you'd like, shoot me an email, and we can put you in touch with people that you need to speak with.
So there is our website and the 800 number also that are on our materials too, so if they want to talk about it. The really cool thing, and I know he's going to highlight on this, so I'm going to turn it back over to him, about the care management, because most organizations, this isn't offered. It truly isn't. It's a sliver of what they're doing, but for us, this is that person-centered care that we're really trying to encourage, so.
Yeah, really trying to go above and beyond for, you know, there was just an article in the news the other day, a couple days ago here in Des Moines, well, about the state of Iowa in general, about how our ERs are so full of people that are there for non-emergent things. You know, oh, my head hurt, my back hurts. I'm sure they do, but you don't need to go to the emergency room for that.
We do a lot of this too on the
Mhm.
private pay side. We have a service that is more like total care management, separate of community.
Yeah, and so, you know, somebody can help them, our care managers can help that patient decide whether or not, you know, they actually really do need emergent care or not. And kind of like Adrian was talking about the change, you know, if they decide to come with Molina instead of Iowa Total Care, you know, we can help them with that transition. Obviously, OB care from, you know, moment of conception to the birth, with doula services, face-to-face home visits, and I believe that they can even go anywhere. Melissa, so when I was talking to the homeless shelters, they were wondering if the care managers are able to come to the shelters, and I get the feeling that it's wherever you call home, they can come visit you. Is that correct?
That is correct with us at this point.
So that's fantastic. Yep. And obviously, like I said, if you do have to be interred for anything or have some long-term care, we've got a care manager following up with you once you get out of there to help you kind of navigate everything. And obviously, there are, you know, certain medical conditions that might be more favorable to having a care manager, such as somebody with, you know, asthma, diabetes, substance abuse disorder, COPD, and high-risk pregnancies. We also help with the LTSS services, which is, you know, basically nursing facilities, long-term care. We provide the coverage, you know, to meet everything, the behavioral, social, environmental, functional needs of the members who are, you know, part of the programs or in the nursing facility, places, skilled nursing facility, homes. And we also have community connectors, which is kind of like the next level down, if you will, but basically helping them with similar things, but more of the day-to-day kind of things, like maybe utility bill assistance, or, you know, finding a food bank. And we'll kind of talk about what Vivian was touching on later here with some other benefits. Where we can even help with, you know, food stamp applications, the Meals on Wheels, getting them set up for that kind of thing. So we're providing, you know, some different layers to the patient's health care, which is, you know, I think great for them.
One thing that stands out with those community connectors is the fact that we do have a housing specialist and an income specialist, and then even a justice specialist. So a lot of those individuals that might be having barriers coming from prison or coming back out and readjusting, they're able to connect with them as a community connector.
All right, Leslie, here you go. As far as I understand, basically the drugs that are currently covered by Medicaid, you know, we're covering the same ones. I haven't been told of any major changes. So like I said, as long as the people you're working with are on Medicaid and are familiar with the medications being covered by Medicaid, there should be no disruption there. So here's kind of the bread and butter, right? That handout that Adrian gave you all, one side is in English, the other side is in Spanish. If you'd also like these electronically, please feel free to shoot me an email. I can send you the electronic version. You guys can hand those out, print them off as you'd like. So, personally, I think this is what's setting us apart from Amerigroup and Iowa Total Care, right? So, you have a rewards program now. honestly, this is the truth, I wasn't familiar with the term value-added benefits until I started working here. You know, I've had insurance of one kind or another my whole life, had no idea that companies even offered these things. So when I'm out and about in the community, I'm definitely making sure that people know about this, because I'm like, you know, I probably missed out on a couple $100 every once in a while. I could have, I don't know, done whatever with. So you get signed up for the rewards program. You can get things like I said, such as a free telephone, a free smart device, free over-the-counter pharmacy products, get youth club memberships, vouchers for the GED test. As Vivian said, that's fantastic. And you get a little extra cash if you pass. And to go with the 54210, wow, too many numbers. You know, we kind of got something to work along with that program there. And we also have transportation, you know, to visit members residing in long-term care facilities. Now, some other things that are on there, the one that I am finding that people are most excited about when I'm out in the community are the rides to food pantries, the WIC office, the housing authority, job interviews, and job trainings, especially the job interviews. I've been going to some apartment functions and some of the homeless shelters, so when those people hear that they can get a ride, you know, to a job interview, the housing authority, to get out of their current living situation and maybe into a better situation, they're pretty excited about that, so some great benefits.
I have a question in mind, because this has been a problem. Clients telling us with the other two MCOs that it's difficult to get enrolled in the rewards program, and then as you're earning points or you're wanting to report, hey, I did this, it's difficult to communicate and say, I did this, and then how to prove that you did it, so you get the reward. Walk me through, how does somebody enroll, you know, and how do they then get the reward?
Sure, so I'll be honest, I haven't seen the actual reward program and how that all works. I don't know if either of you have.
Self-attestation, yeah, you got that for me, thank you. So we have multiple options, and so even if they are a Molina member, they can always call into the 800 number and talk to us and say this is where what they're wanting to do, so they can talk with a case manager that will walk them through that. With their phones, and I know that not everybody's phone savvy, so we do have that option of them calling in to sign up for those rewards, get those cards, and they're a gift card. They can be a gift card. There's multiple different options and ways that they can to use them. So on the Molina page, they're each going to get, if they get that cell phone, anything like that, they're going to have opportunity right there that says value added benefits. And then they click through that, and it's going to walk them exactly how to do it. The case managers are going to be there to help them. The connectors would be there to help them. Casey or myself, we would love to be able to come back out after it is up and going and walk you guys through it as the navigators, so that you would help your clients in doing that. From what I've seen so far, because remember our go live is July 1, is that it looks pretty darn simple. And I'm not a tech savvy person. Just ask Abby over there that we were having an iPhone class before we came here.
And I think I could kind of just piggyback what Ann was talking about. One of the things, like with trying to get those rewards, you do have to have like a computer to get online. And it is kind of more of a challenge, so I hope that that's the case, and it'll be really easy, because it is a challenge. I worked with a client that just last week tried to get her cards, and she did have to do a follow-up with the call because things got kind of a little bit hard for her. I really want them to be able to access that rewards, because right now with everything so expensive, that's just gonna, really, they're gonna benefit from that. So that, hopefully that'll be easy here.
Do you know, Melissa, in terms of our website, how many languages that's going to be available in?
I don't at this time, but I'm sure we could go to welcometomolina.com IA and check it out and
English
see.
and Spanish.
Yeah.
And that, to be honest, I was kind of Googling once just to kind of see what other states have, and that's really all I could find. I know some companies try to go the route of, there's like a Google Translate function they can put on there. Not always accurate, not always great, but.
Calling in too. I mean, that's it, again, we still have those numbers, and we still have people answering.
Just FYI for I don't know how recent the idea of this was, but in Dallas County, the three most prevalent languages are English, Spanish, and Arabic.
Yep, I've got them actually, hopefully, working on some Arabic things. out and about, I'm finding that too, there's a lot of Arabic language. Finally, like Hmong is also very Korean as well. In Perry, work in Perry a lot, like Eritrea is, that's a huge group out there. And, yeah. Yeah. We're working on, hopefully we can get them all. I'm gonna push for that. So this just kind of piggybacks on kind of what we already know, right? Medicaid members generally are not paid anything for services. Sometimes there's a copay, but that's pretty rare. And if they do get a bill, you know, they should definitely give us a call and see what that's about, because more than likely they should not be paying for that. Just like the others, you know, you're gonna get a member ID card. You have to present it when you go see, you know, your specialist or doctor, dentist or whoever. And here are the ways to get a hold of us. We got the app, the website, phone numbers, TTY. And so this retermination process, right, is important for them, and I think that's kind of what's going on currently. It's kind of a mess right now with the three companies and people trying to decide, and like we talked about earlier, they don't know, well, what's Molina? This just talks a little bit about that redetermination process. And we can obviously help with that, like Melissa said a few times, call in.
Go ahead, Kristen.
Yeah.
So curious question, when they're getting those letters in the mail to say, hey, this is your new provider, do they get any education about that provider, or is it just the name?
I haven't seen the paperwork that they're getting. I wouldn't think that,
It's just the letter.
okay.
Just the letter?
Yep,
Yeah.
it's just the letter. And then, like you said, on the back side, it says,
Yeah, obviously all the letters I've ever seen from DHS are just,
it's just a
this
one
here's your
pager.
name and this is what it's about and that's about it.
Yep.
Now, again, the open choice period is wrapping up here, so
Right.
once that has ended and the assignment is set. Thank you, Casey. Once that open choice period is done and the MCO is set, and we receive kind of that roster of membership, it's actually gonna be right here in June that we'll start sending out those welcome letters, postcards, and communications and educations for members so that they know what to expect and how to get a hold of them as their new MCO.
Like I said, you guys have my card. You can consider me to be that letter if you'd like. I'm more than happy to show up wherever you are, to come and talk about Molina, so I can be your